Good morning, Miss Law. So did you end up studying capillaries last night like I asked?
I looked over some notes from class and I think I have a good idea of the physiology.
Okay, sounds good. Would you like to share some basic background with me?
So capillaries are the smallest blood vessels in the body. They're similar to nephrons in the excretory system in that they take advantage of surface area to direct blood flow. Additionally, the small size of the capillaries allows for single direction blood flow, and these things together improve diffusion. So capillaries are also found in the major muscles, tissues, and anywhere else that needs nutrients.
Awesome, great start. So we'll get more into the depth later, but I asked you to study capillaries because we actually have an interesting case coming in with a 4-year-old who's having some issues that appear to be due to malnutrition. So I'd really like you to listen carefully as I do a history and my initial exam.
Okay.
Hello, you must be Amanda, and I'm guessing your dad. So this is my student, Miss Law. Is it okay if she joins us for our consultation today?
Yeah, that should be fine.
Awesome. So can I have you come up on our exam table and tell me what's been going on?
I feel like poop.
Hey. Well, she hasn't been eating much lately, but her stomach's been getting really big. Also, she's been acting kind of bratty and irritable. And according to her, she's been really weak and tired a lot.
Yeah, my tummy is really big.
So could you maybe examine and tell me what you see?
Sure. Hi, Amanda. How are you feeling?
Been better.
Okay, so obviously her stomach has some extensive edema, but I also see some swelling at her ankles and feet.
Okay, could you maybe tell me, has Amanda been losing weight recently?
Yes, very quickly.
Okay, so we're gonna go run some tests and we'll return once we have the results. This might take some time though.
Okay, we'll be back.
So can you think of any capillary related explanation?
I remember hearing about something called marasmus.
Okay, well you're on the right path, but remember marasmus doesn't have edema as a symptom. So try looking up some information about Kwashiorkor and figure out how that might be related in relation to capillaries.
Kwashiorkor. Okay. Kwashiorkor. What the heck is this disease? I've never heard of this in my life. And the doctor just wants me to do all the studying on my own.
So you've had some time now to find some information, and what did you find?
I found some basic information on Kwashiorkor, just the surface stuff. Kwashiorkor is a nutritional disorder that is mostly seen in regions of famine. Most commonly, this disease is seen in sub-Saharan Africa, and it's a form of malnutrition that results from a lack of protein in the diet. Kwashiorkor is mostly found in infants and children up to 5 years old, and children affected with Kwashiorkor sometimes may never reach full growth. So that's all I found. I couldn't really figure out how the capillaries are involved.
Okay, that's fine. Well, before we link Kwashiorkor and the capillaries together, let's make sure we understand the normal physiological function of the capillaries themselves.
Okay.
Bulk flow is the physical movement of fluid from one location to another. Two pressures are important in understanding bulk flow. The first is capillary hydrostatic pressure, otherwise known as CHP. This is the hydrostatic pressure within the capillary vessels, also known as the blood pressure. This pressure is variable throughout the capillary system and is driven mainly by the heart. The second is blood colloidal osmotic pressure, or BCOP. It is controlled by the colloidal proteins in the blood and regulates reabsorption of water. Because proteins in blood cannot cross a semipermeable capillary cell membrane, blood has a higher colloidal concentration than tissue fluid. At the arterial end of the capillary, fluid exits the capillary since the CHP is greater than the BCOP. This is known as filtration. Specifically, CHP is 35 millimeters of mercury and BCOP is 25 millimeters of mercury. By subtracting BCOP from CHP, we get 10 millimeters of mercury as a net filtration pressure at the arterial end. At the mid-capillary, there is no net movement of fluid since CHP is 25 millimeters of mercury and BCOP is also 25 millimeters of mercury. At the venous end, reabsorption occurs when there is a net negative filtration pressure. Fluid re-enters the capillary because CHP is 18 millimeters of mercury. This is lower than the BCOP of 25 millimeters of mercury. These three areas of the capillary bed contribute to the net filtration pressure, or NFP, which occurs when fluid moves from an area of higher pressure to an area of lower pressure. NFP is negative when reabsorption is occurring, like in the case of the venous end. Does that clarify things?
Yes, I do remember a lot of this, but how does it relate to our patient?
Well, think about what you learned about Kwashiorkor and think about what was the most defining feature of this.
The edema.
Exactly. Now, what do you think causes the edema?
Well, the fluid is pooling into the body, so there must be a difference in the pressures, which would be caused by a decrease in protein, right?
Yeah, so now that you're on the right track, let's go discuss this with the patient as the results show the decreased levels of protein in the blood.
Okay.
I don't feel good. When is the doctor gonna come and make me feel better?
Soon. And if you didn't eat mac and cheese only, then maybe you wouldn't feel too bad.
I'm not hungry for anything else.
Okay, so we have some results for Amanda.
Thank goodness, she's been getting pretty antsy. What's going on?
So basically, she's showing very low levels of protein in her blood, which is most likely what's causing her edema.
Wait, what's an edema?
It is the accumulation of fluid in the body, which is what you can see happening with Amanda. So basically she's got swollen feet and ankles, especially her belly.
Accumulation of fluids, can that lead to anything bad?
Well, basically these results are pointing towards a disorder known as Kwashiorkor, and this is because she has a lack of protein in her blood, and since protein is what regulates blood echoic osmotic pressure, it causes a difference between the two driving forces of net filtration pressure. This is because the BCOP is in direct opposition with the hydrostatic pressure.
So in the case of Kwashiorkor, the BCOP is lower than the hydrostatic pressure, which creates a positive net filtration pressure. This means basically that fluid is leaving the capillaries and pooling in the body. This is what's creating the edema.
Kwashiorkor? I don't think I've ever heard of that before. Is she going to be okay?
So you just learned about this. Do you think you can explain what Kwashiorkor is to them?
So basically, Kwashiorkor is a result of not eating right. So Amanda, you are a growing young lady and you need to make sure you're eating right. You have to make sure you have enough protein and vitamins in your diet. And why do we care? Well, basically they affect bulk flow in the capillaries. And I can draw out what's happening in the capillaries so you can have a better understanding. So basically, you have this big artery, and it leads into this net of vessels. And on the other side, you have a vein, which is leading to the heart. So here we have a bunch of little branches, tiny little blood vessels, all in a big net. This is to maximize surface area and to improve diffusion. So this is what we would call the capillaries. And you have exchange between nutrients happening here. And basically you're leading from, this is from the heart, going this way, goes through the capillary bed, blood flow goes in this direction, and in one direction because the capillaries are so tiny. And then this would be to the heart. And that's basically what the capillaries are doing. And so since she hasn't had this condition for long, we don't think it should be a problem for long-term symptoms. Basically, we can add some proteins in her diet and it'll help bring up the BCOP above the hydrostatic pressure, which is causing the reabsorption of fluid.
Yay, that means I get to eat peanut butter for dinner.
I think you need more than just peanut butter for dinner.
Precisely, no picky eating for now.
Thank you so much. Hopefully this will also change your attitude too.
It should help decrease the irritability.
Thank you.
So,
Completely moved.
Or maybe not, you must be dead.
You must be dead.
tell me how you're feeling.
Like poop.
Hey, I've noticed though that you're... Be careful.
And since we've gotten the test results back that conclude the decrease of protein in the blood count,